And now for more on this, we are now being joined live by Jagriti Dave from Washington, D.C. Jagriti, a very good morning to you. Thank you so much for joining us. So tell us, we know that the death toll in the U.S. has crossed the 10,000 mark, and it seems that the country is gearing up for what many are calling the hardest week of the pandemic. Could you share a few more details about the situation on ground?
Yes, of course. As you say, over 10,000 cases, over 10,000 deaths, over 360,000 cases. This is the week, one of the weeks that President Trump has said is going to be a painful week ahead. Today at the briefing, however, and indeed, as you talked about there with the governor of New York, Andrew Cuomo, New York State, which is the epicenter of the pandemic in the United States, is appearing to show first signs of some leveling off. But both Andrew Cuomo and Dr. Fauci, the US's top infectious diseases expert, has spoken about this with significant amounts of caution. They don't want to preempt anything. They are making the message they're bringing out is that Americans need, and New Yorkers need, to make sure that they continue mitigation, they continue social distancing. Right. They don't want to see another spike. They don't want to preempt a drop and then see another rise afterwards.
Right. Now, we also know that President Trump has requested the Indian Prime Minister to lift the ban on the export of the drug hydroxychloroquine, and even hinted at a possible retaliation if India does not cooperate. So now India has in fact lifted the ban partially. So can you tell us a little bit more about what this retaliation means that the President is referring to?
Well, he didn't explain what the retaliation would be. He sort of, what he said was that, if he would ask the Indians if they would, he would ask the Indian Prime Minister if he would allow the drug for the US to put orders in for the drug. But if he didn't allow some of it to come through, then that would be okay. But then there would be retaliation. And it almost seemed like a throwaway comment. But of course, he's talked a lot about how the US has been treated badly by India with tariffs. They've had a long-standing issue with trade and with the issue of tariffs, viewing Indian tariffs as extremely high. And this is part of a long-standing dialogue between the two countries as to how they can resolve these differences. So one of the possibilities could be along the lines of tariffs. We've seen this with the US's relationship with China. And so this could be one of the ways in which this retaliation he might have envisaged.
Right. Now, you also mentioned it, and so has the President, and he signalled at a possible levelling off of infections at a recent press briefing, which suggests that this could be the peak of the disease in the US as of now. So how accurate is this assessment of the situation?
Well, there are different models at play here, and the health experts on the task force are using specific modelling to suggest that, as we know, the numbers, anything between 100,000 and 240,000 people could die. This is despite mitigation, but they said this is modelling. So this is a changeable number, they say, based on the figures that keep being added of the number of cases and the number of deaths. And so there isn't really what they're saying is what people are saying. The general feeling is that there isn't entire certainty on this. It appears that the peak is flattening. It appears that in other parts of the country there is suggestions that the number of cases are on the rise, and there could be a peak. So, say here in Washington D.C., for example, is one of the places they're looking at. Detroit is another city that they are looking at. New Orleans in Louisiana is another place that they're looking at. So different states are leveling at and rising and leveling at different periods. And so there isn't really one time where we can say this is where it ends in the United States. And the main thing is that Dr. Fauci, the infectious diseases expert on the task force, is saying that really he's suggesting may not be possible to go back to normal before there is a vaccine.
Right. Jagriti, my last question to you. We are now hearing that the US will begin taking blood tests and samples to determine coronavirus immunity in the country. Can you tell us a little bit more about this?
they are looking into antibody tests in order to essentially find out whether people are have had the virus and whether they essentially have some kind of immunity to it. But this is one of the things. They're looking at therapeutics, they're looking at antibody tests, and of course the long term, the ultimate goal is to find a vaccine. These are all things that are in play. There are companies that are private companies that are working with the CDC and the government on all of these areas, and this is sort of really a race against the clock. The stay-at-home orders, the social distancing measures that have been implemented by the White House, they are at the moment in place until the end of April, and of course this is hurting the economy, this is hurting people's livelihoods, and so the race for all of these elements is on to try to get this to curb the spread as soon as possible.
Right, Jagriti, thank you so much for your time and for your insights. We'll come back to you for more details soon. And now let's shift focus from the US to the United Kingdom. 24 hours after he was hospitalized for persistent COVID-19 symptoms, British Prime Minister Boris Johnson has now been moved into intensive care. Doctors at the St Thomas Hospital in London say that his symptoms worsened on Monday, forcing them to take this call. Reports indicate that the Prime Minister was given oxygen before being shifted to the ICU. But Downing Street is yet to confirm these reports. The government maintains that the Prime Minister has not been put on a ventilator. Downing Street's messaging has also changed over the last 24 hours. Initially, they maintained that Boris would remain in charge of the government, but the latest statement says that Foreign Secretary Dominic Raab has been asked to take over tasks wherever necessary. The Foreign Secretary has vowed to implement the PM's directives and assured that the government is under complete control.
There's an incredibly strong team spirit behind the Prime Minister and making sure that we get all of the plans that the Prime Minister has instructed us to deliver to get them implemented as soon as possible. And that's the way we'll bring the whole country through the coronavirus challenge that we face right now.
Dominic Raab will now be attending all the COBRA meetings and leading Britain's coronavirus response. Crucial decisions like the need for restrictions on movement will now rest on his shoulders.